Hey, hi guys, nice to see you all again. Can't believe it's a week since we last spoke. It's gone so fast. I'm coming to you today from my lovely home in northern Arizona. So you may see some dogs, cats, or any other kind of animal hanging around, and you may hear the cicadas in the background. Can't do anything about them. I did ask them to be quiet, but they took no notice. So today what I wanted to focus on and talk about is how you, as caregivers or professionals or a person living with dementia, can make practical use of the Nightingale model of enriched care. So I want to talk to you about what makes up that model, and it's based on true person-centered care. And there's a whole list of them here, and so I'm going to go through them and discuss how each one can be used effectively to improve quality of life. So the first one says that true person-centered care accentuates the positive and minimizes the negative. So what I'm saying here is that we focus on strengths, we focus on ability, and we really build and grow those things. We don't focus on what we can't do or what we struggle with. We focus on what we're good at. And that is what's really important. And that's typical of life in general. It's no different. It just means that what we're good at is what we focus on. And the second thing is that true person-centered care focuses on all the strengths and abilities rather than any disabilities. When we look at somebody who's living with cognitive change, we must look beyond any challenges, any disabilities, and really build on those strengths. And then when we need to look at those challenges, then we take it and we change it, and we look at the challenges and we build on those. We say, okay, where's your challenge? Just like the brain health exercises, if somebody's having a difficulty with language, with perception, with speech, with memory, then we can start to build on that, and we can start rebuilding those areas where a person is struggling. But always focus on the strengths. Always focus on the positives. The third thing we talk about is how true person-centered care promotes well-being and minimises ill-being. A positive rather than a negative approach. So positive well-being will see people who are happy, who are engaged, who are in conversation, people who are doing things, active, laughing, smiling. Ill-being, on the other hand, would see people who are sad, who are depressed, who are not engaged, who are not active, who are not conversing and being involved in society and community in general. So we want to focus on well-being and promote that as much as possible. And I'll talk to you a little bit more about how we do that. Person-centered care focuses on the perspective of the individual rather than that of the caregiver. So by that I mean that we have a responsibility to step into the world of the person who is living through cognitive change. It's our responsibility to step into that world, to validate people's beliefs, to validate where people are right now, and to meet them where they are in their journey. True person-centered care is planned around the individual and not the home environment, the care home environment, the memory care environment, the nursing home environment, and it isn't task-oriented care. It doesn't really matter about the tasks. It doesn't really matter whether the bed's made or not. It doesn't matter about any of those things. It's more important to focus on the things that the individual is enjoying and the things that the individual can actually focus on. And we always kind of, as I said earlier, meet the person where they are. If we meet the person where they are, then it means that they are empowered, they're in control, they're leading whatever it is that we're doing, whatever interaction, whatever engagement they are leading it. The person-centered care sees behaviours that challenge others as an expression of feelings. So it's not something that the individual is struggling with, it's something that we are struggling with, and that we have to see that, and we have to work with that, and we have to understand what feelings that individual is expressing. So communication-wise, if people are struggling with communication, then we have to learn how that individual is trying to communicate and what that means. So we always look behind the real meaning of person's behaviour and try and find out what it is that they're actually saying, what their emotions are. Sad, angry, upset, hurt, frightened, agitated, anxious, and then work with that. True person-centered care acknowledges that there's always a reason for a behaviour. Behaviour is a form of communication. Communication is a form of behaviour. So always realise, recognise, acknowledge and embrace that that person's behaviour is a form of communication. And not everybody is able to express that, for example, they're in pain or discomfort or they're distressed. Some people don't know why they're feeling the way that they feel. And we have to explore that, and we have to really get to understand what that person is expressing. True person-centered care accepts the reality of the person and doesn't insist on bringing him or her into our reality. We spoke a little bit about this last week, about not challenging people, not confronting people, but validating their feelings, validating their beliefs. An example of that is not telling a person that their mother died when he or she is calling for them. So instead of saying, well, you know, your mother's dead, we would say, what's your mum's name? Dorothy. Really? My mum's name is Dorothy too. When you get together, what kind of things do you do? Oh, we like to go shopping. Cool, so do we. And we like to go to the cinema. Really? What do you go and watch? Oh, we like watching James Bond. Oh, I love James Bond. In fact, I think I've got a James Bond movie that we can watch. Would you like to watch the movie? Oh yeah, that'll be cool. So you're validating that individual's belief, you're entering their reality, their world, and gently you're redirecting them from the distress into something more positive and productive and constructive. So always remember to step into that world, validate, and then just go with the flow. And when people are using words like, I want my mum, I want to go home, if you look behind those words and those meanings, people are really saying, I feel frightened, I need a hug, I need some care, I need some support, I'm feeling lonely. So just be there and give the person that support that they need, and that guidance, and that care. And you know, the best thing in the world, and this has been, especially in the UK, has always been very controversial. But I'm a hugger, and I hug everybody. And all my patients know this. When I greet them, we hug. When they're leaving, we hug. I'm a hugger. And hugging has so much positive benefit for people. It has many, many physical and psychological benefits. So don't be afraid to hug somebody. Don't be afraid to hold their hand. Don't be afraid to comfort them. It's a very positive thing. True person-centered care doesn't, this is really important, doesn't use detracting words. We don't use words, well, he was uncooperative, he's a wanderer, a feeder, a sufferer, a walker, a non-amb. All these words are words that we hear often, and the press, the media, are the worst on this planet for using the word suffer and sufferer. So we avoid those words. We don't use those words. They're negative. And if you tell somebody that they are suffering from something, they suffer from it. If you tell somebody they are dealing with, they are coping, they are managing, they cope, they manage, they deal with, and they move on. And they don't get stuck in that rut. So avoid that negative language. Don't use it. True person-centered care is implemented by caregivers, by everybody that is on the journey, supporting that individual. And we try to see things through the person's eyes and not through our own eyes. We try to use empathy as much as we possibly can. So those are the ways in which we think about true person-centered care. And then the model itself, I'm just going through my book, a little plug, the Nightingale, a clinician's guide to non-pharmacological dementia therapies. This is a book that I wrote, and it's useful for everybody. You don't have to be a clinician to use this. It's very practical. And the model is described in here. And it's really about, there's 4 things. And one is community presence. Something that happens to people who are diagnosed with a memory issue, a cognitive impairment. One of the first things that happens is they get sad, they get down, their self-esteem and their self-confidence takes a massive hit, and they start to withdraw. They start to withdraw from activities, they start to withdraw from all the things they've been doing and engaging in, and start to stay inside. And it makes the situation worse. So community presence, and the second one is community participation. Those 2 things are absolutely crucial, that we continue to support and encourage the person who is living with a cognitive impairment to actually do. Continue with activities, continue going to the bridge club, continue with golf, continue with whatever it is that people do. Got to continue with it, encourage it, promote it. What we're trying to do there is prevent the person from entering a clinical depression, because that's when it's difficult. We struggle to get people out of clinical depression. So if we can involve and engage and encourage a way out before it gets down there, we're doing a good job. Valuing people. It doesn't matter where the person is on their journey, they have some value. People have lived a life. No matter how old they are, no matter how young they are, they have experiences, life experiences, they have skills, they have competencies, they have abilities, and we have this real responsibility to continue to value people and remind them regularly that they still have a contribution to make. And the 4th part of the model is about respect. Respecting people, respecting who they are, where they've come from, their journey, their life, and respecting everything that that person brings to the world, because no matter who they are, no matter where they have been, we must respect each other. So those are the 4 parts of the model. So in order to introduce the true person-centered care that we talked about, follow those 4 principles, and you will find that the quality of care of that individual and yourselves and every one of us on the journey is increased. So that's what I wanted to talk about today. Again, if you have any questions, please post them on the YouTube channel and we will answer them. Please share this channel. As I say every week, we need more and more people to subscribe to this channel, because the more people that we educate, the better. We now have 107 subscribers, so let's see that increase over the next week. That'll be fantastic. You can find out more about me and what I do at drdanielnightingale.com. The book you can get from Amazon or Barnes & Noble, wherever it is. It's all over the place. Clinician's Guide to Non-Pharmacological Dementia Therapies. Some really useful stuff in there, very practical. Thank you for following me, thank you for supporting me, thank you for all that you do. If you're out there caring and supporting people who are living with a cognitive change, thank you. Keep up that fantastic work, and together we do make a difference. Thank you, and I'll see you next week.